Hi everybody, I am Dr. Ramesh Chandra. I am a specialist joint replacement surgeon and my chief specialization even in joint replacement surgery is navigated knee replacement and hip replacement surgery. And I have been practicing joint replacement surgery since last 10 years and I have significant numbers under my belt. And I have converted all my joint replacements to computer navigated joint replacements in the last 1 year. The benefit with a navigated hip and knee replacement is so significant that in this day and age with this technology available, I would not recommend anybody to undergo a routine hip or a knee replacement surgery. So why do we require a knee replacement or a hip replacement? So I would not talk about the hip and talk about the knee because that's one of the most common things that we as Indians face. So a knee joint essentially is a composition of three bones. The upper bone is called the thigh bone or the femur as we call it in English, and the lower bone is the shin bone or the tibia, and in front of these bones is something called the patella or the kneecap. So in normal individual we have a covering over this bone. The covering is called a cartilage. So this cartilage, the cartilage covering over the bone wears out over a period of time. It's a soft covering. It acts as a shock absorber and also reduces the friction in your joint. When we say a knee has worn out or you're getting arthritis of the knee, it has nothing to do with the bone directly. It has to do with the cartilage. The cartilage wears off and it gives rise to the underlying bone getting exposed. And when that bone starts rubbing against the opposite bone, we start getting creaking sounds, we start getting pain, we start getting crepitus, we start getting stiffness. And that's the time when mostly patients come to us. So to make it simpler for you, this is what we call as a knee joint. Okay. And in the knee joint, there is the femur, like I said, there is the tibia, and there is a kneecap in the front which has been taken off here. And the bone is covered with this grey covering, it's called the cartilage. So in normal arthritis, when you start saying the person has got severe knee arthritis, the cartilage is completely not there and it's just bare bone, and that bare bone starts rubbing against the bare bone below, and that is called as severe knee arthritis. We call it stage 4 or stage 3 of arthritis. So what can we do as an individual, or what can you do as an individual to prevent you from getting arthritis? Well, the process starts very long time back when you are a small child. The more you exercise and the more physically fit you are, the thicker the cartilage covering. That's in the initial stages of your life, first 20-25 years. So my proposition is that as a child, or if you have children, make your children to be more physically active. Make them exercise, make them play sports, let them do whatever they want, give them good nourishment so that their body is able to withstand stresses afterwards in life in a much better fashion. Number two is if you have bow legs, like a lot of Indians have bow legs in the villages or people from certain communities because they don't get exposed to sunlight. So those kind of individuals end up getting vitamin D and calcium deficiency. That can give us to bow legs, and a bow leg will alter the architecture or the shape of your legs.